Good morning. My name is Josiane. I will be your nurse for today. How you doing? Good? Okay, can I have your name and date of birth, please? Okay, thank you. I'm here today to do a trach section for you. So the trach section will help you to breathe better. And before I do that, I'm gonna go ahead and check your vital sign because I want to make sure your heart rate is okay, your respiratory rate okay, and your SaO2 okay. All right, everything okay, good. And then I have my amber bag over here, so I'm gonna put it by the head of the bed so I can use it in case I need. And then your suction, okay, just make sure your suction is running good. And I have your oxygen here. I'm gonna go ahead and put your oxygen on all the way to 100% while I'm doing the presentation. Okay, thank you. Now I'm gonna go ahead and start preparing my material. Okay, first, before I start, I'm gonna go and put my mask on to protect the patient, to protect the sterile field, and to protect myself. Okay, now before I start, I'm gonna just go and loosen the cap of my sterile water. I will sanitize my hands. Okay, now I'm gonna let it dry a little bit. Okay, now I'm gonna go ahead and open my sterile fill. You need to be careful, not touch the inside because it's a sterile procedure. Okay, now I'm not gonna use there's a glove inside. I'm gonna just pinch, not to touch all the stuff. I'm gonna put it on the side because I want to use my own gloves. Okay, can sanitize again. So 1, 2. Okay, now I'm gonna open my own gloves. Garbage. Okay, so side to side. Okay, now I'm gonna start to don in the first hands. I'm just gonna pinch the cuff. The glove is a little sticky, so I'm gonna try to fix it. It's a little bit sticky. Okay, I got the first one done. I'm gonna do the second one. I'm gonna use the 4 hands and I'm gonna keep my thumb out, way up, and step away of the film. Okay, done. Now I'm gonna go ahead and pinch the cartridge section. So I'm just gonna drop this on the garbage I keep my hands below my wrist, and I'm just gonna use my right hand as my dominant hand to keep the catheter fully here. Okay, now I'm gonna dip and take the little bucket I have here so I can put the water in. Now open it. Let me put it here. I have my stable water here. This hand, the left hand, it's non-stable right now. So the right hand is stable. Because I already loosened my cap, I'm just gonna open and pour some water. Be careful not to touch the edge of this. I'll put some water to test the suction. Okay, remember, like I said, my left hand, still non-sterile. I'm gonna use my left hand to take the suction plug right here. This is my suction plug here. I'll take it and hook it here with precaution to not touch the right hand. Okay, now I'm just gonna switch hand over here. Well, be careful not to touch this. First thing I'm gonna do, I'm gonna test to see if my suction is working. I'm gonna dip it in the water and do some intermittent suction. Okay, it's working. Now, I'm gonna start my suction. Okay, I'm gonna start suctioning. I know you might feel a little bit discomfort, but when I start, so you're just gonna need to take a deep breath, okay? Thank you. I put my oxygen away. Okay, now I'm gonna start with the suction. I go down to 3 to 4 centimeters, and I keep my hand a little bit high so I don't touch anything. And I keep put it down until I see like an inch. Or if the patient is coughing, and I just start. Now I'm going out. The patient is coughing. I put it out right now, doing that, and then doing this by intermittent. Okay. And now I put the oxygen back with still the left hand. There's some secretion here. I'm gonna clean it up. Okay, it's clean. Are you okay? Okay, I give her some time. Now I'll start the second one. Oxygen out. Okay, do the same thing, 3 to 4 inches. Going down, down. Okay, patient coughing. Now I pick it up with intermittent suction. Okay. Put oxygen back. You okay? Okay, now I'm done. This is soil. I unhook this one, and then I'm just gonna take this off. Take it off with my hands. Garbage. Sanitize my hands. You feeling okay? All right. Thank you. Now I'll take the stuff away. Now the garbage. Take off my mask. Okay, Mrs. Laura. We done over here with the suction. Here's your call light. I'm gonna prepare for the trach care. I'll be right back.